When I was living on the streets, I was prostituting, I was homeless, and CHOW saved me from becoming HIV positive. They showed me love and compassion and treated me like a human being. And that was so important because that helped me to start loving myself, I guess.
CHOW is a harm reduction based organization. We're a nonprofit that's independent of the state, and we work for the health of drug users and the people affected by drug use. We're a non-judgmental organization that sees drug use and abuse as a public health issue and a social justice issue. By giving out clean syringes and exchanging them for dirty ones, we're getting them off the street. Last fiscal year, we exchanged over 1 million syringes. That's 1 million times that people weren't exposed to bloodborne pathogens. We're all about meeting people where they're at, so never pushing people further than they're ready to go in terms of where they are with their drug use. And we give them the support that they need to make changes when they're ready.
Well, CHOW really started in the streets from folks that saw people dying of HIV and heard from overseas and from the continent that there was this idea called syringe exchange, where folks that were using needles were at risk for HIV and other bloodborne pathogens, but that if you could get them clean equipment, then that risk is reduced dramatically.
And we can see from the data that's collected every year since the very beginning of the epidemic that the syringe exchange program has had a dramatic impact on the transmission of HIV among injection drug users. And when we look at Hawaii compared to other states where they do not have syringe exchange programs, the numbers of injection drug users with HIV from sharing syringes continued to rise, whereas in Hawaii, it really leveled off. And today, it is relatively rare that we find a new infection of HIV that's been caused by sharing syringes.
A lot of our participants come to us and they say, I like coming here to talk to you because you're the only person I talked to today who didn't make me feel like a bad person. Drug use takes on the role of also like helping with that emotional unwellness from being isolated. I think what keeps people coming back is that human connection.
You know, I mean, a lot of the clients, I know them personally. I used to use with them. And, you know, they see me now and they're like, oh my God, what did you do? You know, and I tell them what I did. You know, and I said, you can do it too.
The thought is that if we're giving people the equipment they need to use drugs safely, the thought is that we are actually making it easier for them to use drugs, but the research does not bear this out. And there's been over 200 studies that have found that syringe access lowers HIV risk, does not increase drug use, and not only makes those folks that use needles safer, but makes the entire community safer. So one day of the week, folks are in Chinatown here in urban Honolulu, and then one day the other van is at a different part of the island. And so it's going into communities. We set up appointments to meet people there. We'll go to different parks and try to find new folks. But it's really taking our services into the community because we know that that's a better model for our participants.
So as we sit here, we wait for our clients to come and they're exchanging whether 1 to 100 needles. We're here from 9 to 2 p.m. There's a lot of regulars, but then there are new incoming clients that are coming to the van also. A lot of folks, they come and they don't know about the CHOW project. So we meet them, we greet them, and we show them what we do. Needle exchange helps the community and it also keeps the community clean.
And so I can't imagine us not being here, especially with the amount that we're doing, because when I started, there was like, you know, I mean, we did maybe 3,000 needles a year. That's huge from now, 1 million, you know, it's just like, it's huge. I believe that the connection is there with me, with a lot of clients. I know how they are. I know who I can joke with. I know who I need to really listen to, and other people, I get pissed off, you know, and I let them know it. And I think us being here and we're stable kind of a presence, a consistent presence, I think that really helps them a lot. They really appreciate that.
With the CHOW project, the staff that's worked there and the leadership of the organization, people that are really dedicated to serving a population that often doesn't get many services. They have listened carefully to the clients that they're serving. They are really part of that community. They do not set themselves apart. And because of that, they have a lot of information, a lot of understanding of what services are needed and what's the best way to provide those services.
We really need people to have dialogues about stigma, about compassion, about what addiction really is. And it's not a moral issue. It's a public health and a social justice issue. We need to treat it as such and start, providing services and providing the funds to create more services that see it as such and treat it as such, and only then will we be able to make any change.
We call it a party for our participants. It's really a health event. It's a collaborative event that we do with the community. We're doing wound care, we do testing for HIV and hepatitis, we have public health nurses come, we have the health department come and do vaccinations.
We serve lunch, we give outdoor prizes, and we invite other members of our community to help provide services at that time.
So when the participants come to the party to eat the pizza and get prizes, we give them prizes by them getting a sheet of paper. And so every single service provider they visit and get their initials, they get more raffle tickets, and then we give them raffle prizes for stuff. And it's incentive to get people to go talk to everyone. And I always say to people, you don't have to talk to anyone. You want to just come hang out, eat free food, that's cool too. We're happy to play that role for people, to be there for them when other people will not be.
CHOW has been, they've been very helpful, especially with the needle exchange. A lot of people that I know throw it away, which might lead to spreading of hepatitis, HIV. If you're not currently involved with CHOW, I think you should at least, if you're skeptical about it, you should at least get informed about it. I think it's very helpful, and I'm very thankful that CHOW is there for me today.
People really use drugs for a wide variety of reasons, but predominantly, folks are just wanting to have connection, and I really see CHOW as being that kind of bright light for when that person feels like they're ready for that next step. And until then, to keep them safe, keep them well, and also to know that they're a valuable part of our society.
The people that use drugs are part of our community. It's our brothers, it's our sisters, it's our neighbors. And sometimes people are down on their luck, people's lives change, but they're still members of our community. And we are very lucky to have an organization like the CHOW Project that understands the community and really operates as our representatives, our ambassadors for working with that community.
People seem to forget that drug use is such a tiny part of who that person is, like in the grand scheme of things, and it makes it really hard to be able to make changes. CHOW is working hard to take care of people who nobody else wants to take care of.
CHOW's purpose is to teach, respect, help, and support without judgment and with compassion. We're not enabling people, we're educating and helping people to help themselves. CHOW's not a handout, it's a hand up.